Welcome back to No, I'm Just a Worm with your hosts, Ann Jeanette.
And Jess?
And in this week's episode, we are talking about people that have chronic pain and how they have to kind of fight with doctors or like the medical community in order to get the pain management that they need
Yes.
because of the opioid crisis that's going on throughout the country, not just in our area.
Right.
But there's there's so many battles, and not just for people with chronic pain, but for the poor, for um
People who are underinsured.
yeah, so it's just, or people that have like the problem goes deeper than
Just lack of access.
yeah.
And yeah, like we'll get into that a little bit because we were discussing just the many, many, many layers that go into not being able to receive appropriate medical care and pain management. But I had wanted to bring this up because I'm kind of on the opposite end of it. I am in recovery. I've been in recovery for over 10 years and I work in the drug and alcohol field.
Hmm.
So, my job is to get people back on their feet without using opiates. But then I started to kind of think like I've had some clients coming in over the years that are like, well, I got on pain medication because I have like 5 herniated discs and fusions and I have this wrong and that wrong. And, you know, it- do I know if 100% of their stories are true? No. But, I'm going to like take their word for it. Like these particular people, I have no reason to believe that like they're over exaggerating or lying. But, they were going to pain management for years. And due to some of the pressures with new regulations, their doctors were kind of like, yeah, so you're done. This is going to be your last prescription and no taper plan and good luck.
Deuces.
Yeah. So that's led them down to either just not knowing what to do and coming to our clinic, or unfortunately some people, turning to the streets. So
Mhm.
yeah, but looking at that though, and then we'll get into like a little bit later on our main topic. But I wanted to interview my good friend Monica, who has a very long list of chronic illnesses, and she's very open with her story.
Yeah.
So I kind of wanted to see like what her experiences have been and others in her community.
So yeah, before we get all into that very serious topics, we're gonna bullshit for a little bit because we have that's what we're good at. I
Yeah.
feel like, and we have a lot of bullshit material in which to share. So last time we were working on a segment that was called "What's Wrong with Us," and we have a lot of stuff that's wrong with us. So we're gonna continue with that and our pet peeve segment, and we'll build off of that as we go because we keep figuring out more and more stuff that's wrong with us and shit that bothers us. And some of you guys have actually like commented as well about things that are wrong with you.
Thanks for sharing.
Yes, and now we're going to exploit that trust. So do you want to start with what's wrong with you, or should I start with what's wrong with me?
No, so I'm gonna dive into what we were discussing earlier. Yeah. Yeah. So this is a pet peeve that kind of like went into the what's wrong with you portion of it, specifically though aimed towards Anjanette. So I was saying earlier, it's like my pet peeve is when it's a beautiful day out and you have a lot of natural light in your home, but yet you still have lights on.
Mhm.
That pisses me off. So one of the things I love about my house is we have a ton of natural light. It's a gorgeous day out today. There's no reason to have any light on. None. And yet as I'm going through the house, I don't have children. But yet,
Just a boyfriend.
just a boyfriend, and yet
That's like a child.
I get, yeah, it is. I go through the house like, let me turn the office light off. Let me turn the hallway. I'm like, why are these lights on? It serves you no purpose. You can see just fine. So it drives me nuts. So as we're sitting here discussing this, she kind of had that look on her face, like, well, I have all these lights on my window. I'm like, okay, but for our purposes for today, like we need like the windows, the blinds closed, these lights on for it to like work for our recording. And then she admitted that she just always leaves them closed.
I don't like it.
So her rationale for that though is that she doesn't want the neighbors to be able to see in the house during the day
I
with the
know.
lights when they can't see inside.
I know that during the day they can't. I don't like people. I don't like them knowing my stuff. We discussed last time about the whole like male like you get junk mail or
Yeah.
whatever,
Yeah.
and so like I'm just a very private, closed off person when it comes to that. Like I would love to have a house in the woods when there's no fucking neighbors, and like I can't stand. Oh, I can't stand. It creeps me out. I don't like it when we're driving down a street, like a residential street at night. You know, people have their lights on inside, and the fucking blinds are just open. Curtains are just open. I can see right in. I can see it's with perfect clarity. I can see everything. It's ground level. I can see all that you do. I can watch Frozen with you because I can see it on your TV. Like I that freaks me out. I don't like that. I wouldn't like that is literally like you have a spotlight on in your house saying, "Look at my testicles," because
So,
that's what that is.
but I can understand that. So I can understand wanting them closed at night because people can see in, and I will admit that
You're one of those freaks.
I am one of those freaks.
Her
However,
curtains are purely decorative. When she closes them,
they're sheer.
they're sheer and they don't cover the entire window.
Nope.
They're just there to, they're like stupid bangs. The curtain bangs. The bangs don't work for your window.
They don't, and I did buy them strictly for the purpose to be decorative. There was no intention of hiding anything.
Oh my god.
But anyways, back to my point of why you're crazy is because literally yesterday she was complaining about how cloudy and gross it's been, and yet on a beautiful, gorgeous, sunny day, she's sitting in a fucking cave of just gross, fake light. Someone who has vitamin D deficiency and a seasonal
That's why
depressant, you
I
would think you would
take
want to sit in the
vitamin
sun.
D. That's why I take vitamin D. But also, as someone who is fair and is more susceptible to skin cancer and melanoma.
Now you're stretching it. You're stretching
No,
it. Yeah, you are. You are not going to get sunburn or melanoma by having some freaking curtains open in your house.
I'm just saying that's why I take vitamin D. That's why I don't go out in the sun. Because
Then don't complain
we
that
pale
it's
ones.
cloudy out, okay? Like
I
you
have
can't.
every right to complain when I go out there and it's cloudy as shit.
So you complain that it's cloudy and then you complain that it's sunny.
I don't complain that it's sunny. I just don't want to be in
Lies.
it. There's a difference.
There isn't.
There is.
You're splitting hairs.
I think you're the one that is splitting hairs.
Am I?
Yes.
What's wrong with you?
You're saying, "Oh, enjoy the sun. Let it, wash over your face in all its glory." No, I don't want the sun to come on my face. I want the sun out
That
there
sounds really
where
dirty.
I can look at it and I can see through the blinds. I'm like, "Oh yeah, it's bright out. That's
But you
cool. I like it."
don't. But I'm saying that you don't do that.
I can see it. I can see the sun. It's beautiful.
So
It's
you
gorgeous.
guys can't see that the blinds are completely closed.
But I can see the light shining through.
Barely.
That's God smiling down upon us.
I must slap you. I swear to God. So yeah, my pet peeves is leaving lights on when they don't need to be on. It's not necessary.
Yeah, I don't. If I'm not in a room, I think I don't know who's more guilty, me or Steve, of leaving lights on. But it's not like we'll have every light in the house on,
Right.
even in rooms that we're not in. But I'm probably more guilty of leaving them on when they don't need to be on. Like in the morning, I have a routine. I will come out and when I'm getting ready for work, I have work at 6:30 in the morning, so I get up at 4:45.
Ugh.
And I turn on this little hallway light that's right by our bathroom. I'll turn on both bathroom lights. I'll turn on this dining room light and the kitchen light, and then I turn on the outside lights because I don't see well in the dark. And at that time, it is dark out.
Yeah. Yeah.
So that I don't have to keep turning them on and turning them off, because that actually produces more of a surge of electricity than just leaving them on.
Right. I mean, I could understand that. Plus, you want to have your body start to wake up.
Yeah. So
Yeah.
I will leave them on, and then as I'm leaving, like, I'm done in the bathroom, I turn those off. I'm done with the hall, I turn them
Yeah.
off. I'm done with this, I turn them off, and then I leave the outside lights on because until, like, Steve gets ready for the morning. Because when he leaves, by the time he leaves, the sun's actually up. Fucking jerk, but, yeah, I don't know. I'm probably more guilty of doing that, but
I mean, I think that makes sense though, because like you're using all three rooms pretty quickly. Like you said, it doesn't really make sense for you to like be out of a room for a minute or two, turn it off, turn it back on right away. But you're turning them off though as you leave.
yeah,
So Will doesn't do that. He was in the office for 0.25 seconds to grab something. So why he turned the light on to begin with, I don't know.
yeah,
And then just left it on. Wasn't going back in it. He was going out to the garage.
yeah.
So it's stuff that drives me insane.
Well, we also have, like, in our like, that would probably piss me off too, but in our living room, we have blackout curtains because the window is directly opposite the TV, so you'll get a glare. So
Right.
we don't open those at all. And honestly, I don't wanna be bothered with having to open these blinds here in the dining room and then having to close them. So that's one of the it's laziness is one of the reasons, and then neighbors. But I digress. Let's move on to my pet peeves and then what's wrong with Jess. Um,
It was a lot yesterday.
yeah. Oh my god. But anyway, my pet peeves, I wrote in the comment of like one of our posts, and I guess it was kind of like it was sort of like a what's wrong with you, but it's sort of a pet peeve. So I like popping
I read that and I was like,
bubble
what
wrap,
the hell?
but I cannot stand if someone is next to me or near me just idly popping bubble wrap.
Or clicking pens, I've noticed.
Oh god, it like so like repetitive noises like that are all just drive me banana sandwich. I can't. I can't. It like it I get so irate so quickly that I have to like fight not to like just tear it out of their hands and punch their face. Like it just I don't know. I don't know what it is about me, but like even when I was little, like I had a hamster that would chew on its cage, and you would just hear this.
As hamsters do. Yeah.
And I'm like, you have sticks! You have sticks to chew on. Why are you chewing on the metal bars of your cage? Be like, here, there's more chewies. And he would just continue.
Because he wanted freedom.
Yeah, well, whatever. You're trapped for life. Get used to it. I give you food. I give you water.
Yeah.
I change your cage. Like,
Yeah.
fucking quit it.
No, when I had Chino, our ferret, I did not realize they're nocturnal animals. And I need my sleep. And I get very cranky if my sleep is disturbed. Uh,
Yeah, you do.
but he
Do
would.
not sing to her in the morning. She does not like
No,
it.
no, don't do it. He would wrap his fangs around like the door of his cage and just rattle it. So even downstairs, you could hear it as if it was right next to you. And I'm like, you gotta stop. You're not. Go to sleep.
Mm-hmm.
Go to sleep. This is not happening right now. No. Mm-mm. Mm-mm.
Yeah, they I didn't really notice it too much with my rats. Like every once in a while they would chew on their cage, but like for the most part, like whatever you gave them to chew on, they would chew on.
Yeah, mine were pretty chill with that too, for the
Yeah.
most part. But even so, like, so when I had my rats, I was in college. I lived with my grandparents, but I had my bedroom, and then there was the rest of the house. So they were in my bedroom, but even at night, I had to boot them. I just picked up their cage and like put them out in front because
I had to do the same thing because I had mine in college as well. I would have to put them like right outside the door
yeah,
because they would wrestle
yeah,
at night. I'm like, what the fuck are you guys doing? Like,
display of dominance.
yeah, like, but they were brothers, and yet they would just like beat the shit out of each other, and you would just see little sprays of blood. I'm like, guys, can you stop? Like, I have,
This isn't Sparta.
yeah, gotta clean the walls.
Oh God,
Jesus.
mine weren't that bad. But again, though, like any little noise while I'm sleeping, and there's just hell to pay.
Yeah.
I was asleep last night, just started to fall asleep, and I need to go to the grocery store. Like we have almost nothing in the house. That's not an exaggeration. So I had
I've
like,
seen her fridge.
yeah, it's bad. So I had like a half a bottle of water. That's like it's my water. I brought it up with me. And I guess Will got thirsty. So instead of just getting tap water, he just marched upstairs. And I rolled over and immediately woke up and just whipped my head around. I'm like, "What are you doing? Like, this is my water. Put it down."
Oh my god. Ay, ay, ay.
It's like, "Put it down and get the fuck out."
Yeah.
Sleeping.
Kind of like I don't know if you would see in like sitcoms when you were younger, like the dad falling asleep in the armchair with the TV on, and
Yeah.
they would go to turn the TV off, and they're like, "Hey, I was watching that." Like they would wake up all of a sudden, and be like, "I was watching that. What are you doing?"
Yep.
Well, you weren't because you were fast, like you were snoring.
Yeah.
But there were a lot of things wrong with Jess yesterday.
So many. I don't know what was wrong with me. I really don't.
She we were talking about well, one of the things, the most recent thing that stands out was like we were talking about the election coming up
Yeah.
and the candidates that like who's gonna be the, like the Democratic candidate.
Yeah.
And I don't know, did Will say Sanders or Bernie?
Will said Bernie, and I meant to say, because he's like, it's just going to be Bernie. And then I meant to say that it's going to be down to Sanders or Warren.
But she said, I think it's gonna be Sanders. So Will and I both said at the same time, Bernie is Sanders. And then we all died. But
Yeah.
like Sanders and Warren,
Two different.
they have the A in common.
No, I mean,
I
literally
guess
none.
R as well, but like there was like
No
they don't
reason for
sound the
it.
same.
No.
There's no reason for it.
I don't know.
Mm,
I really don't know. And it did took like sometimes if I make a mistake like that, like you notice it as it's coming out of your mouth. You know what I mean? And
mhm.
it took me a second.
Yeah. It wasn't until after we said Bernie is Sanders that she was like, "Oh, well, that's not what I meant." Like, oh, sweet honey baby. Like,
Yeah.
what else was wrong with you yesterday?
I couldn't put that freaking dinner special thing back in its
Oh,
holder.
yeah.
I gave up on that real quick. I was just like, whatever. It's out of the way. Just-
You're just struggling left, right, and center.
I was on the struggle bus pretty hard, and
You rode it
I
all the
wasn't
way
really
to the
trying though
station.
either. Like once I realized that like this is just gonna be the rest of my night, I was like, nope, you guys have to deal with me.
Thank God you weren't driving.
Yeah, no, I had one drink when we got there.
Yeah, but you were fucking up before the drink too.
That's what I'm saying.
Mm-hmm. One drink and you nursed it for a while, so it's not even like you were tipsy with the whole Bernie Sanders thing.
Nope, nope. My brain just went. We're in a short circuit today. The hamster is jogging, not running.
I don't think he was even like jogging. I think he was kind of like
Sauntering.
he was sauntering and he was like getting distracted by like he was the spaced guinea pig in that video.
Yeah.
He's just like,
Existential crisis.
and then he would turn back on. He was like, "Oh, right. That's what I was doing."
Yeah, I'm a little bit better today.
Are you?
Yeah.
That's good.
Shut up.
I still like I have many instances where I walk into a room or I'm doing something like I want to see the footage at work because I have so many cameras at work. I want to see the footage of me like walking somewhere and be like, "Oh shit," and I turn around and I go somewhere else, or like I actually will like I'll be doing whatever at work and then I go and I turn. I'm like, "Wait, right." I don't like, and I just turn it back on. Like it's literally like
You could just see you slowing down of like, wait a minute.
yeah, like what was I doing? No one knows.
I know some of the comments that we had, one was from Lisa who said that she hates cream cheese but loves cheesecake.
Okay.
And I feel like I can kind of understand that though, because they taste completely different.
They do. I mean, I like both, but
Same.
I know plenty of people that um they don't like tomatoes, but they like ketchup.
Yeah. Some or ketchup, just anything tomato based. Like the recipe's like you need tomatoes to make that thing.
Yeah,
But yeah, but they won't eat just a tomato.
I'll eat it all. I would eat just a tomato,
I'm not that bad. Mm-mm,
like an
no,
apple. I used to do that when I was a kid.
no.
Um, I well, I like all things related to what you would do to pickle a cucumber, but I don't like pickles.
Wait, what?
So like if you were gonna go and make your own pickles,
Yeah,
like the spices and
yeah,
what vinegar that you use to make a pickle,
right.
I love all those things. I hate pickles. I
I,
hate some.
I don't know. I mean, I guess it's one of those things where like you like all the ingredients, but just because you like them separately doesn't mean that you're gonna like them
Yeah.
together.
There was one person I know, they liked peanut butter and they liked jelly. They didn't like peanut butter and jelly.
What?
Yeah.
What?
They liked peanut butter on things. They liked
Right.
jelly on toast or something like or jam on toast,
Yeah.
but they didn't like peanut butter and jelly sandwiches.
That's all right. That's weird.
Yeah.
Such a classic.
It is. I think they had a depraved childhood.
Like I kind of wanted one before I left, and then I realized that we don't have bread because I need to go to the grocery store.
Oh my God. Steve and I were realizing the other day that um it was kind of like we were driving to the restaurant and we were discussing. He was like, I'm not really hungry, but I know I'm gonna eat all of the food that I'm gonna get.
Oh yeah.
And he's like, so maybe I'll just eat the burger and then I'll save the fries. He's like, but I already have fries from the other restaurant that we went to earlier that day. So I'm just gonna have so much fries.
And
I'm
then
like,
he brought home my fries.
yeah. And I was like, talk about your first world problems. Like,
Yeah.
you're complaining that you have too much food.
Yeah. That's
And we as a nation, the amount of food that we throw away could feed an entire country.
it's true, and yet we still struggle with food.
Yeah. With
Oh, what's the fucking word I'm looking for?
food uh
It's not gonna come to me, but
distribution, food problems. I don't know. Well, with poor, like
it's not. The word's gonna come to me like 2 days from now.
near the end of the podcast, you're just gonna scream a word, and we're gonna be
Yep,
like, "Oh,
that was it.
okay. I gotcha,
But anyways, I mean, we still struggle with people that are going hungry in this country, and the amount of food, like you said, that we throw out is
Oh yeah,
disgusting.
like there's we live in a country of abundance, and yet there are people going without.
Yeah. Like I remember, Will had worked in a local grocery store chain for a very long time, and they had brought in a new company for their pumpkin pies.
Yeah,
So like they were doing a test. So like they put instead of just putting like one pie on like the top rack, middle rack, and bottom, just to make sure like they cook through evenly, depending on which rack. Like they basically just filled like this entire rack and baked them,
mm.
and then didn't like it.
Oh
So Will's like, okay, well, like why don't we just sell them for like a super cheap, or like can I just take them down to like the soup kitchen
yeah.
or the homeless shelter? Because there's like 20 some pies in this thing that we're just gonna chuck that are perfectly fine. You just don't like the consistency of them. And they're like, yeah, no, we can't do that because of liability purposes, and just throw them all out.
Unfortunately, like that's like there are a lot of companies that feel like they need to do that because of liabilities. The fact that
Right.
like someone at some point probably got a pie like that or got food like that and then got sick and then sued the company. So they're like, well, because of this precedent that has been set,
Right.
we can't do that.
Right. And it kind of screws everyone over, much like the opioid crisis and the way that it's been handled. Perfect segue. Boom.
Segue.
Um. So yeah. So just like a quick overview, real quick, and I'm sure everybody has heard of the Sackler family, Purdue. Um. I think they recently filed for
I have not.
bankruptcy. Are you fucking kidding me? No.
Nope.
All right.
I would explain it to me and our listeners.
Okay.
Because,
Uh,
like, when you were talking about the other day, I was like, "Am I supposed to know what's going on?
all
Because I
right.
don't."
So there's been a lot of questions on how did we get where we're at with this opioid epidemic and how, people are addicted to opioids. They're getting cut off of them if they were prescribed. Now they're going to the streets, um, which is turned into like heroin addiction. And now over the past like 3 or 4 years, we're going into this huge fentanyl
Oh, yeah.
issue. And
Yeah.
but just like fentanyl that's either coming from pharmaceutical grade or just being made in a lab somewhere on the street. So kind of like fast forwarding to like the mid to late 90s, Purdue kind of struggling a little bit as a pharmaceutical company. And at that
Mhm.
point, there wasn't a pain medication that lasted more than like 6 to 8 hours. So that's obviously a struggle for appropriate pain management. Like that's, a difficulty. So they had that and obviously like the concerns of dependence.
Mhm.
So they had created Oxycontin. They're the makers of Oxycontin.
Oh, okay.
But they blatantly, and you can like look it up right now, they blatantly said this is a non addictive and non dependent pain medication.
Oh, whoa.
So
That was a
that
lie from their mouth.
yeah. So that was the issue, and this is why a lot of people were going after Purdue, not just Purdue, but there's a couple of other companies and pharmacies. Anyways, mainly Purdue, but if you look into it, there are other companies that are starting to get pulled into this. But yeah, they blatantly said like, yes, this is good for basically any type of pain. So like short term, long term, back pain, knee pain, major surgeries, cancer, like literally any type of pain, which is really realistically should be for chronic, like serious pain, not just hey, like I had a knee scope, maybe I need something like
I have an owie. Could you
yeah,
make it go away?
ba-
Here's some oxy, sweetie. Go on.
yep, basically.
Yeah.
So, because they were sitting there educating these doctors that it's not dependent, it's not addictive. You can take it you only take it twice a day. So, it has long term pain, but they never actually show them like, okay, between the 10 milligrams all the way up to 80 milligrams, like which is appropriate for what condition,
Mhm.
how long based on each condition should they be on it for. But if it's not addictive, who cares? It was kind of like the mindset of it, and just the amount, like I said, of just blatant lies that they had on their marketing campaign and the lack of education, is where people are kind of putting the responsibility on. But then if you look at it, it's like there's so many other factors that go into that.
Mhm.
So you have pharmacists who are educated on what this medication actually is. So,
Mhm.
and they do have a responsibility to flag, um, like an abundance or a huge surge of a narcotic coming in. Right. So, like pharmacists are obligated, like if they have one doctor, who's in their community, mainly the only one that's prescribing a narcotic at high levels for questionable conditions, like they do have the right and the obligation to report that to the DEA.
Yeah.
And they were starting to find that a lot of certain pharmacy chains like weren't doing that, or they weren't doing it in a timely manner.
Okay.
So they were just basically slapped on the wrist for it. So nothing really much happened with them.
Well, like they got like a fine and they just
Yeah.
paid it? Okay.
Yep. So, and of course, the fines are like, oh my God, it was like a $6 million fine. I'm like, well, when your revenue is like almost $1 billion,
Yeah, they're like,
write that check right now.
that's
Whatever.
like a drop in the bucket.
Yeah. Um, so you had those issues. You had, again, doctors that maybe started to like, you know what? I'm going to prescribe it the way that I feel is necessary. We had doctors that just realized that are just shitty people and just realized that this is like a cash market and that they could unfortunately make money on those who are addicted. Um, so if you watch The Pharmacist on Netflix, it's actually a really good series that opens up a very small glimpse of some of the issues that one of the issues that we got to where we're at now and the regulations that we have. But there was one doctor in Bernard Parish, which is right outside of like Ninth Ward of New Orleans, who was licensed as a pediatrician, would only go into her office like starting around 9, 10 o'clock at night, was only cash pay, didn't accept insurance. And then you could drive by at night and see like all of these cars and people just waiting, like for what? So there was a smaller pharmacist, obviously like in that area, like you only have like mainly mom and pop shops. So he started to notice like people that seemed very healthy coming in, getting prescriptions like a cocktail of usually like 40 milligrams to 80 milligrams of Oxycontin with either Valium or Xanax and Somas. It's like
Somas?
Somas.
What's that?
Um, if I remember correctly, it's either
I'm
sleep medic.
playing the role of I'm dumb.
Um,
I play
it's
it well.
it's it's either sleep aid or a like muscle relaxer. I think one of those. I think it's a muscle relaxer.
So kind of along the lines of a Valium.
Yeah.
Okay.
So, but he's kind of like just starting to see like this huge surge of like this weird cocktail for like what is. So he started asking people like, "What's your condition? Like, what do you need this for?"
Yeah.
And some were like, I have a couple herniated discs. Some were like, I'm recovering from like a major surgery, cancer. And he's like, okay. And then some were just like, well, I had knee surgery like 6 months ago. And he's like, you shouldn't need this anymore. Like, there's no reason that you need this medication.
Yeah.
And it was like I said, it was this huge surge that he started to like basically record everything, start to like pay attention, contacted the local DEA, which apparently they were already looking into this particular doctor, talking to people who were at her clinic. They were just like, listen, she's just a drug dealer.
Wow.
Like I sat in her office for 12 hours the other day just to get like medicine, but she doesn't take insurance, so it's like $200 for a prescription that she just okay, here you go. Like there was no conversation, there was no exam. So when the DEA cracked down, they had found that she had written for a population in their parish of 70 some thousand people. She had written over 180,000 prescriptions for narcotics. So clearly,
Oh my God.
clearly there's some illegal activity going on. But because
Yeah.
she was getting huge kickbacks from Purdue. And a lot of like the sales reps and stuff were like, you need to push it, you need to push it. So, and again, like I mean, they had gotten one of her bank statements and she had deposited like almost $2 million into her account at one point.
Jesus fuck.
So obviously, this is not like, and unfortunately, there was enough doctors that were doing this in addition to Purdue lying about this medication that kind of that kind of led us into the shitstorm that we're at now, as far as like the amount of regulations, as far as how many prescriptions that a doctor can give out within a certain amount of period like time, needing to submit to the insurance companies like why they're on it, how long they're supposed to be on it for, the prescription monitoring program, which so originally you'd be able to track down how many prescriptions a patient had filled per doctor via the insurance company. So so if they paid cash, you were kind of like there was no record of it. So now the prescription monitoring program, the pharmacists are obligated, regardless of how you pay for it, to submit to a state database to show what doctor gave you this narcotic
Yeah.
and how often. So, like at our work, we check it all the time. That's just standard for us, just because it's basically supposed to crack down on doctor shopping. Is supposed to what it does.
Yeah.
Um, but that kind of shitstorm of just a situation over the past almost 20 years has spilled over into a community who might have some really, really rare diseases that cause a lot of chronic pain. And this is affecting them on getting the appropriate pain management that they need.
Yeah.
So my frustration, like I was telling Monica, like I get frustrated with the doctors and the insurance companies that they can't tell that there is no more individualized care anymore. It's just like a blanket statement.
One size fits all.
Well, yeah, one size fits all, and that's just not how medicine works.
That's not how anything
No,
works, really.
true.
Like,
But that if she and I were to sit down in front of the doctor, go over like the pain that she's experiencing with her conditions, and then the pain that I experience, we shouldn't be treated the same.
no.
And the doctor should be educated enough, and the insurance company should be educated enough to know who actually needs this amount of pain medication, who doesn't, and
Mhm.
for why. So, that was something I wanted to reach out to her and talk about her experiences, and then just the community that she's involved with, because the conditions that they have, like, they're unfortunately, this is a lifetime struggle. Like, there is no cure for it. It is not going away. And
Thus
they,
the term chronic pain.
right.
Like they have this chronic illness. Like it's not lifetime.
Right. So I was interested to see how she manages her pain and then how they've been affected with it. So let me read you off the cocktail or the cocktail. To keep using that term.
She has a whole slew
Yeah.
of diagnoses.
Yeah. So one the main diagnosis that the other diagnoses are caused by, I guess, is
So
one
like
way.
there's a the
Yeah.
Ehlers-Danlos
Ehlers-Danlos syndrome.
Ehlers-Danlos syndrome is the reason why she has all of these
Yeah.
other things that branch off of it, because
Right.
that was
Connective tissue disorder.
yes, that is genetic.
Yes.
So she inherited that from someone in her family.
Right. And it's like I said, it's a connective tissue disorder that affects the collagen specifically, which I didn't realize that collagen was literally in everything in your entire body.
Well, yeah, that's what makes up like what your joints and your ligaments and
Tendons.
tendons and everything like that. Mostly ligaments and tendons, but because of that, people that have Ehlers-Danlos syndrome tend to be like hypermobile.
Right. Yeah. So
Uh,
she was saying like before she started to get the bad headaches and stuff from some of the other conditions, her her head she just thought she had really good range of motion. So she was able to like look like over her shoulder.
she was an owl, but in real life.
Right. She didn't think there was anything wrong with it. So
She's like,
about
that's just normal that
yeah,
I can exorcist my head.
all the way around almost.
No, sweetie, no one can do that.
I guess almost 5 years ago, she was struggling and starting to notice, I think, some signs, if I remember correctly, of like not having the best balance, the case of the dropsies, just like little stuff. Knew that she had like the hypermobility to some extent, but again, just thought it was just her natural range of motion.
Hmm.
So she ended up in the hospital with the worst headache of her entire life.
Yeah,
So to the point where she went to the hospital for it. So they gave her the migraine cocktail, which is
I wrote
uh
it down.
did you? Okay, good. Please hold.
Valium, I think OxyContin or oxycodone, Dilaudid, and Zofran. So you would get a muscle relaxer, you would get a painkiller, two different painkillers, Oxy and Dilaudid, and then you get Zofran, which would help with the nausea, and that is the
Wasn't that the cocktail they had tried for her? I don't think that's a migraine cocktail.
yeah, that was a cocktail.
Are you sure? Because I know
Yeah,
the migraine cocktail had like Benadryl in it, tramadol, and then like an anti-inflammatory.
and that was the cocktail that they gave her at some point. I just assumed that
Yeah.
that was the
All right. Hold
migraine
on.
cocktail.
Hold on. Please hold.
Okay, apparently I'm wrong.
I'm so, no. That was definitely I think that was the cocktail that they had given her that worked. Hold on for a second. Migraine cocktail.
We're
Don't put that
professionals.
away.
We're professionals, and we won't hear
Don't put
otherwise.
that away.
Why?
Because we're gonna need it.
For you said my notes were
Yeah.
wrong.
But the other ones weren't. Benadryl, Compazine, and Toradol IV. So that's typically if you go into the emergency room for migraine, that's what they give you, and that didn't touch it. So she was eventually, after like constantly presenting into the hospital for migraines, she was diagnosed with Chiari malformation, which is basically your cerebellum, right?
The base of your brain starts leaking into your spinal column.
Right. It's like herniated.
Yeah, so like your brain is supposed to be like up in your cranium, and the very base of the brain starts going like kind of gets sucked through the top of your spinal column.
Right.
Because I too have Chiari malformation, but a very very low grade of it.
Right. You're well, a lot of people have it and are asymptomatic.
Yes, like that's I. The only reason that I think they found out for me, like I had to get an MRI just like she did. That's how she found out that she had it.
Yeah.
So obviously hers is worse. But the only reason that I had it, I don't. It was before I found out that I had hyperthyroidism, but I was having I think I was having like unexplained blurry vision.
Yeah.
So nothing was working. So I had to go. Like I went to go see an ophthalmologist, And then I like checking all sorts of stuff with my vision to see like, well, did you scratch your cornea? Did you do something with that? Like, I'm
Right.
like, no, 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 no. Did you hit your head? I'm like, I'm pretty sure I'd remember that.
Right.
But also on the flip side of that, you might have hit your head and then you wouldn't remember because you have retrograde amnesia.
Oh God.
But I didn't do that. So it wasn't like trauma, like brain trauma from like hitting my head or anything like that. So they were like, okay, well, the only other thing that we can do is get you an MRI. And so, like, me just presenting that as a symptom, like, I don't know, I guess I was fortunate that I had doctors that were like, all right, let's do this instead of like prescribing you some random drug or some shit.
Right.
Let's try to find out an answer. And
Yeah.
like, they'll just throw something like that at me. So then I had the MRI and then I find out they're like, oh, okay, it's Chiari malformation. But sounds much like very, very scary. And my doctor, when I was trying to I was asking questions while he was trying to tell me about it, but he was telling me like a doctor telling another doctor. And I'm like, dumb it down a
Yeah.
bit.
Small
Okay.
words. Small
Yeah.
words.
Little, like, just, how would you describe this to a toddler?
Yeah.
And that's how you should describe it to me. And that I found like, he seemed like a little bit impatient trying to describe it to me. And that's just, you know, an issue with our medical system. But that's beside the point. Back to,
Yeah. No, so I mean, obviously, so that's what was causing her severe headaches was her brain falling out of her skull. Um, and then eventually over the past year, she's also been diagnosed with craniocervical instability, which basically because of the hypermobility that she has in her tendons, cartilage and all that, basically just like not holding up her cranium the way that it should be.
which makes sense.
Mm, basilar? I'm
Let
probably,
me see.
yes, please take this. Eek. Ow.
Yeah.
Yeah. Yeah. Not so easy, is it? Mm-hmm.
Basilar invagination? I'm saying invagination,
You know
and
what?
I'm pretty
Give me,
sure that's
yeah.
not it.
Give it back.
Brainstem compression. That's what that is. She should have
Cero-
sent something that like the phonetic
yeah,
pronunciation of it.
cerebrospinal fluid leak, postural orthostatic tachycardia syndrome, inappropriate sinus tachycardia, mast cell disease, chronic fatigue syndrome, and fibromyalgia. So, due to the main diagnosis, though, of Ehlers-Danlos syndrome, she has a hard time metabolizing and absorbing just really anything. So once they had the original diagnosis, it was finding the right cocktail of pain medication that her body would appropriately absorb and not make her sick.
Hmm.
So she said, like, morphine does nothing for her. I mean,
Yeah.
the average person that would knock you in your ass, she's like, it literally does nothing but make me want to vomit. And same with like Oxycontin, just like it does nothing.
Yeah.
So I think that original cocktail that you had named off was what does work for her. But she was saying she was lucky enough though, like once she started to do her own research on the conditions, on what doctors in her area specialize in it. Like the hospital that she goes to, the ER, is affiliated with those doctors. They
Yeah.
have her info on file, so like people don't think that she's drug seeking. They don't give her the wrong medication that isn't going to work for her. Um, what she had, so she's had several surgeries done, and actually like when we post this, I'm hoping to get some of the pictures of before and after, because it doesn't take a doctor to realize like your brain ain't supposed to be there. They were pretty like, holy shit, there's something going on there.
Yeah.
So they had to take, if I remember correctly, they had to take like a good chunk of her rib bone to fuse like her neck to stabilize it.
Jesus fuck.
And basically there's just like a plate back there holding everything in. And
Yeah.
then I think they did something to like alleviate the pressure because, some of the fluid and stuff like that is leaking down where it shouldn't be.
Yeah.
So, and then that was kind of like, I think she was saying like kind of again, like herniating her spinal cord and her brain stem because there was just so much pressure just like on that one spot that controls everything. So it controls like your metabolism, your balance, your body temperature, your blood pressure, just all kinds of stuff. I mean, literally every system and aspect of her body has been affected by all these disorders.
Yeah.
So I had asked her, like we'd asked her, like how, like just your average for you, your average day to day,
Mhm.
like how do you manage your pain and what's your pain level at? And she said on an average day, her pain level's at a 5.
Yeah.
But she chose to not take anything stronger than like Excedrin and your basic medications unless it goes past that and she really needs to.
Yeah, when it does, then she takes low dose naltrexone.
Yeah, so they started giving her the low dose naltrexone specifically for her bone pain and not like joint pain, like legit like bone pain and something else, which is newer. So,
Mhm.
but unfortunately with that, just gonna close your notes there.
Yeah, because apparently my notes aren't good enough, so I'm gonna have to
You're
put them away.
fine. You're sorry.
It's whatever.
It's one of the few times that I'm actually remembering everything we discussed. Let me have this. Anyway, so the naltrexone they gave her recently, they found that it helps with specific pain, like her bone pain, a couple other things, which she said has helped a lot. The flip side to that, naltrexone is an opiate blocker. So in my field, we treat with buprenorphine. So buprenorphine helps with opiate cravings, and naltrexone again blocks the opiate receptors. So if you use an opiate with naltrexone, it does nothing.
Right.
So she kind of had to gauge which pain is worse and which like side effects and stuff do I want to deal with, which is one of the reasons why she chose not to take the crazy cocktail of pain medication on a regular basis because she's like, I have to try to time it out and space it out between like these other medications, and then you have side effects with it, which a lot of it are gastrointestinal, which she's like, I don't really want to deal with, and I have to take another freaking medication on top of that. She's like, it's just too much.
Yeah, like if you've ever been prescribed a narcotic, like for the surgery that I had a breast augmentation. I was prescribed an obscene amount of Percocet, like 45 days worth, which my insurance company was like, no.
Yeah,
And I was like, well, yeah, I understand. Um, but like I think when I was getting it filled, like I was like, I don't know what this is because it wasn't, it wasn't the brand name Percocet. It was
oxycodone.
it was but it was a generic, like a different generic altogether. And but when they prescribe you something like that, they also prescribe anti-nausea, and they prescribed a stool softener because apparently when you are on strong narcotics like that, you can't take a shit worth a damn.
Nope.
So I didn't know that, and I was just wondering, I'm like, well, what am I taking this for? What am I taking this for? And my doctor, I think, had explained. I don't know if like there was just so much he was explaining to me at one time that I was like, yeah, okay. And I did not actually fully understand what the fuck he was saying. So luckily, I have two pharmacists in my family, my dad and my brother. My dad's just retired. But I had asked him, like, hey, what the fuck is this and what the fuck is this? And they're like, well, that one's for anti nausea and this one's a stool softener. I'm like, why am I taking this? They're like, well, they normally prescribe these two or things like this if you have a narcotic. And I was like, oh, well, like, I think I was also supposed to get this, but the insurance wouldn't pay for it.
Right.
So I went to the pharmacy and I was like, hey, I was supposed to get this. And they're like, well, the insurance will only pay for this much. So you have to pay this much. Because with the insurance that I had at the time, all my prescriptions, like no matter how many I was getting, would just be like $1.
Right.
And I was like, all right, whatever, I'll pay for it. I think ended up being like $15 for 45 days worth of Percocet. So I got it, and I was like, wait, this is Percocet. I'm not gonna take this because I took one, I think, for some kind of dental procedure years previously, and it like immediately made me vomit.
Right.
I don't deal well with like strong narcotics like that. My body just rejects them. So, I was like, well, I'm not going to take this, but I didn't realize that I was taking these anti-nausea things and the stool softener for no reason.
Oh god.
So I was telling my brother that, and he's like, you don't need to take those because I also was prescribed, antibiotics.
Right.
I had prophylactic ones before surgery, and then I had ones after surgery.
Yeah.
So I was like, oh, well, that makes everything so much easier because they also tell you, like, you have to take this at this time, this, like, 30 minutes after this
Yep.
time, and it's just, like, it was a huge pain in the ass. I'm like, Why am I doing this?" for antibiotics. And he's like, well, these are actually for the Percocet that you're not taking. I'm like, oh.
Oh.
I was wondering why it was so easy to shit.
Yeah. No, but that was one of the reasons why she decided to not do like traditional pain management for what she has, and in addition to all the other medicines that she's taking, like I think she's on one right now that's controlling her blood pressure because that's another one of her systems that's like all kind of crazy.
Oh, yeah,
Um,
because, like, normally, if you stand up really quickly, your blood pressure will drop and you feel, like, woozy.
yeah,
So she could be sitting perfectly still and her blood pressure will be, like, skyrocket,
yeah,
which is, like, the opposite of what should be
yeah.
happening. So
I think she said her resting heart rate was like well over 100, like 140 or something like that. So it's just luckily like she's able to control that with medicine, thankfully.
Mhm.
But I mean, I can imagine like you're already taking these array of cocktail of medications to make sure that your body is functioning the way that it should, because your brain is sending all kinds of crazy like signals. It doesn't make any sense, and then in addition to the different types of pain you're having that I don't think a lot of doctors discuss. You know what I mean? So it's just kind of, again, like a blanket statement of like, well, just take this medication because it's for pain and good luck. This should cover it. Again,
Yeah.
it's not a conversation. Like God, I think it took probably well over a month, 2 months to figure out which type of pain medication our body could handle and metabolize the way that it should to actually be effective.
Yeah.
And I know one of them's like Dilaudid. I think one of them was, like, Percocet that she, like, usually doesn't take, and then I think Valium. So that's, like, kinda the cocktail, like, when she does go to the hospital,
Oh,
uh,
that one was
was
Valium,
correct.
Oxy, one of the Oxys, Dilaudid, and Zofran.
Yes. So, and like I
I
said
got one thing right.
like I said, Zofran was for, like, the upset stomach and being nauseous,
Well, which they would normally prescribe with
any
Oxy.
of those,
Yeah.
yeah. So, and then I know, some of the other surgeries she's had, like, inpatient, they've given her fentanyl as well. So it's just kind of, but it's, I mean, it's taken, like I said, just a weird, and it has to be like in that combination for it to be effective. But I mean, most doctors aren't going to have that kind of conversation and patience to kind of go over that with their patients, and it's frustrating,
Wait, they don't have the patience with
With
their
certain
patients?
patients,
I
yes,
just want to, I'm
yeah,
like not trying to be funny, but like trying to decipher which patients you're talking about.
patience,
So like
patient,
they are
yes,
impatient
yes,
with their patients.
yes.
Just making sure. Thank you.
Welcome. That makes sense. That you asked for clarification.
Yes, because I was like, well, they don't have the patience. Like they don't have like patients, like client patients, or they're being impatient with their patients.
They're being impatient with their patients.
Yeah, like they don't like. I think part of it there was kind of like with my doctors. Like they have so many patients that they do not have the time to take to like go through. Like they're not giving individualized time to each patient.
No.
They're just like, yep, slap a sticker, you're
Yeah.
good.
So that's one of the reasons why it's like right now. I think she said like there's usually once or twice a month where she'll take something stronger than Excedrin and then naltrexone. But her concern, because like I said, the naltrexone's pretty new, so her concern is if she does need another surgery, like she's gonna have to stop taking it.
But also for the naltrexone, she has to get it from a compounding pharmacy.
Right.
And
That's
with
right.
that, like, because normally when they prescribe naltrexone, it's like such a high dosage that it would be like overkill for her.
Right.
So she has to get it from a compounding pharmacy that would actually like make it a specific dosage for her. That's like low dose, like 4 milligrams.
Yeah.
Where normally the regular dosage is I think like
50.
50
Yeah.
milligrams. And like because you deal with naltrexone, right?
Yeah, so ours, so if you're getting it in buprenorphine treatment, or commonly known as Suboxone, it's like the name brand,
Yeah.
it's 8 milligrams of buprenorphine, 2 milligrams of naltrexone.
Mhm.
But if you're going in for alcohol dependence primarily, and you're getting the Vivitrol injection, which is an injection of naltrexone, it's usually like 50 to 100 milligrams because it's a gluteal injection, so it distributes through your body throughout the month. Yeah, and then if we give,
Get a shot in the ass for that?
yep.
Jesus.
So, I mean, yeah, so it's completely different. Like what we'd prescribe is for A, different reason, and B, like, yeah, the milligrams are much higher.
Yeah, so she takes a very low dose of it in order, but she has to get it specially made for her.
Right, which is expensive. I think she was saying it's like over like $90 usually.
Yeah. So
Um,
that's a huge pain in the ass.
so but I mean, I guess at that point you got to figure out like she said, I mean, ultimately at the end of the day, it's just finding out what's going to work for you for your quality of life. So you can like I mean, some people are in so much pain, you just have to figure out what you need to take to get out of bed. just to
Mhm.
like shower and take care of yourself.
Yeah.
So she had reached out to some other members in her community that have similar diagnoses, but at the end of the day, chronic pain. And they haven't been quite as lucky as Monica is as far as working with her healthcare providers.
Yeah, despite all of the ailments that she has, she can still function, like, as if
Right. With again, with like her advocating for herself, doing her research, finding specialists that know her, what she's dealing with.
yeah, like you said, she is lucky that she has the access and the providers that she has, but also, like, despite all the ailments, like, with the surgeries and with, like, the pain management treatment that she's been able to, like, find for herself, she can function, like, she can go to work,
Yeah,
she can
God, she's
function day to day,
yeah.
but there are people in her community that cannot.
Right. I mean, that cannot, and then that aren't as lucky to have the medical providers to have the access. And, when we say access, we mean financially, insurance companies, literal access. So, like, actually just being able to get to the specialist.
Yeah, if they don't have a car or
I know, like,
anything.
most of her specialists are out of state. So she
Mhm.
has one. So she's from the Maryland area. So her one specialist is in DC. I think she recently got a specialist in Virginia.
Wasn't she
And
saying that she had to pay something because the one specialist was in DC, was like an out of state cost or something like
yeah,
that?
yep. So, but I mean, despite the fact that the insurance is still covering something.
Yes, yes.
So, but I guess she said like one of the people that she had interviewed for this podcast in particular had said like as of recently as the opioid epidemic keeps getting ramped up and more regulations are put in place and more people keep talking about it. She has had her doctor cut her dosage in half and frequency in half.
Mhm.
So, if you're used to just hypothetically just throwing out numbers, taking say 40 milligrams of Oxycontin, every 12 hours, in addition to, whatever else you need to go along with that, to have that cut in half and then say, okay, so not only we're going to cut this in half, but you're also going to take it like maybe once a day instead of twice a day. That's affecting your quality of life.
Yeah.
Like, and her condition hasn't changed.
Yeah,
It
it's
hasn't
not
gotten any better.
like we said earlier, it's not something that you can it's not a curable thing. It's just something that you have to live with. But you can manage to live with it.
Right. They've had some individuals who've just been like cut off of their medication completely, doctors that won't treat them anymore. So it turns into how am I supposed to take care of my family? How am I supposed to take care of myself? I still have bills to pay and I have a condition that is here for life and I'm being affected by a non-medical personnel who is putting on these regulations and is controlling my quality of life that have no clue what I'm even diagnosed with and what that even means.
Yeah.
And I think that's her frustration, Monica's frustration, her community's frustration, where I think the average person and nationally is like, well, Purdue's fault for being in like the issue that we're in now and blame them. And it's like, well, no, because this was definitely a manageable, fixable issue. We didn't have to take it to the point where, if you were used to getting 45 days worth of Percocet because that's what you needed, well, now you can only get 30-day supply, and that's typically like one pill a day. But
Yeah.
if you look at most prescriptions of Percocet, just use that as an example, it'll say take one pill every 8 hours, but you're only given enough to take one pill a day you're only given 30 pills.
Correct. Yes.
So it doesn't make any sense. So it's like the pharmacy is looking at the doctor's orders, which states take one pill every 8 hours or one pill every 12 hours, but you're only given enough medication to take one a day.
Yeah.
And that
That's all the
has
insurance will cover.
right. So I think her frustration is all of these factors, non-medical factors that are coming in controlling their access to quality of life.
Oh, let me see what my prescription said. Hold on.
Yeah, go go go. So, like the insurance companies, they have no clue. They're not treating you. They're not sitting in there with your doctor going over the surgeries that you've had, what your prognosis is, what you're going to need day to day, and they're the ones that are dictating what medication that you're going to get. And that's one of their community's frustrations, and rightly so. The DEA again cracking down to go, okay, well, this doctor in particular is prescribing like is responsible for 20% of his community's like narcotic prescriptions. without taking in consideration that maybe that doctor's a freaking oncologist. Maybe that doctor is a rare disease specialist. So this is one of the common things that they're going to prescribe because that's the type of patients they're treating. What's it say?
So I was prescribed oxycodone, 5 milligram tablet. Take 1 to 2 tablets by mouth every 4 to 6 hours as needed.
Yeah, that's more than a
Way overkill. Way overkill. Like there's no need. I would never go through that much.
right.
Like I feel like I wouldn't be able to function every 4 to 6 hours.
Right. But for you, no. For somebody who is in chronic pain with a different type of condition,
Yeah,
that's what they might need.
this is true.
But you're only given 45 days worth, and that's probably
Well, I was given 45 pills,
pills.
actually, 45
Okay.
tablets.
Right. So that's, I mean, if you're taking it as prescribed, and even if you take it on like the longer end, so you're taking it once every 6 hours, you need more than 45 tablets
Mm-hmm.
for you to last to your next prescription. And now with the new
Yeah.
regulations, you can't really, and I know there was like some regulations on this, but it's harder even now to request an early fill. You're not, the insurance company and the pharmacist has the right to deny you to refill your prescription early.
Yeah.
So again, like Monica said, I mean, for her, she might have 2 weeks where she's feeling okay. She didn't have like a really hard week. Her pain is manageable. And then, life happens, stress happens, and she might have a huge spike in her pain level and need to take more,
Mm-hmm.
and it's just there is no way with these certain illnesses to sit there and say, okay, well, this is definitely what you need to take all the time, 100%. And if you have a rough day, good luck.
Yeah. Like, it's not, like we said earlier, it's like you can't have a one size fits all thing with something like this. Like, everyone's life day to day is different. Even, like, same thing applies to people that have chronic pain. Like, their life is going to vary day to day.
Yep.
And it, it fucking sucks.
No,
It's a
no.
lose-lose situation for those living with it.
Yeah. But she, like I was just saying a couple minutes ago, I think it's the frustration of the insurance, like the insurance company is not actually taking a step back and looking at what's going on with their patients that they're reimbursing, and then again the DEA not actually paying attention to the difference between, yes, this doctor is a pill mill and they're just cash only and they're giving you whatever they want, versus a doctor who is an oncologist or a special disease, where yeah, like just common sense and just based on statistics, they are going to have an increase on how many narcotics they prescribe based on what they're treating. So I guess Monica had given the example. There's a doctor a few years ago in California who was rated by the DEA because he had like a huge spike in pain medication prescriptions, but he was treating those with her condition.
Yeah.
She's like, this is what we need to get out of bed.
Yeah. And
Like,
then once a doctor was rated, wasn't she saying that once a doctor was rated, then like all of his patients' information is
yeah,
up?
HIPAA goes out the window.
Yeah. So you're just like, well, what the fuck is HIPAA for then?
Right. Yeah. It's like, and like shit, like you're not doing anything wrong. Like you're just there to get the help that you need. And there's more information in those patient charts aside for what the pain medication and pain management, so it's your diagnoses, it's every surgery you've had, it's other medications you're prescribed, it's lab results, it's your address, your phone number, your social security, it's everything
Yeah.
for something that you didn't do any wrong.
Yeah.
So I think it's just a lot of frustration in her community on, yes, there was an issue. Yes, pharmaceutical companies like royally screwed up and should be held responsible to a
Mhm.
certain extent. And they are starting to. But that, we just kind of went the complete other way without any regard or indication of, hey, there's like a whole separate community that's going to be hugely impacted and their quality of life is going to be impacted. I know she said like the suicide rate in her community is huge because of that.
Yeah.
Um, and it's not fair, and it's not fair to sit there and say too like we're going to put all these regulations to help keep opiates off the street, but at the same time, it's a battle for the insurance company and local government and communities to actually allow us to provide help for addicts.
Yeah. And because of all the like the hoops that you have to jump through, some of the people in her community have turned to the streets.
Right. You know.
So, like, it's just an endless vicious cycle that like kind of feeds on itself and makes it like so much worse.
Yeah. Then as she was saying for her personally, like the naltrexone's been working for her great for a specific type of pain. And CBD as well has been helping a lot for her. But it's still, it's not an end all be all by any means.
No.
It's not gonna be a huge help when she's having like a really bad pain day. It's just like little things that she's starting to explore to, that's just to help with like the day to day and take the edge off kind of situation. And, obviously those are shared with those in her community, but that's not gonna work for everybody. Um,
Yeah. And not everyone's gonna be like, no, I can live with the pain that I'm in.
yeah, no, I mean, God, I can't imagine like before I had the surgery on my shoulder, like a bad pain day for me was probably at like a 5 or a 6 because all of my muscles in my neck, my pec muscles and stuff were just locking in to protect my shoulder
Yeah.
to the point where there were so many days where I was texting and chat. I'm like, I don't know. Before I knew what was going on, I was like, I feel like my collarbone is going to break.
Yeah.
Like that's how bad it was. So I can't imagine my average pain level being a 5 all the time.
Yeah. I mean, I guess in a way to be fair, like everyone's 5 is gonna be different.
True. Yeah, that's
But
true.
so like what you might consider a 5 and what Monica might consider. So Monica's 5 might be like an 8 to us.
Right. Yeah.
She's like, I live with a 5 every day. But we're like, well, what do you consider a 5? And then you would imagine how you would deal with that. I'm like, that I would definitely consider like an 8.
Right.
Like I could not. I would.
Uh-uh.
Mm-mm. So like because she's been dealing with this pain for so long, and that's just kind of like that's just a part of her life. Like she dials it down to a 5, but I would just guarantee that for anyone else,
In
for
her
us,
shoes, yeah,
it would be a much higher number, and you can only imagine what it would be, like what an 8 would be to her. Like we would be like, just fucking kill me now. Which she
yeah,
had said that there were times where she was like, it, before I think they had really fully diagnosed all the different
yeah, and
um
then even after that,
things.
found the cocktail that worked,
Yeah, she would just be like, you know what? If I could die, that would be great.
right?
And like I remember certain times when I had gotten a laparoscope, and oh god, after the laparoscope was done, I was like, I just kill me. Just kill me. If I just literally end my life.
Mhm.
And
Yeah,
there was a brief moment after the breast augmentation. I was like, yep,
this is it.
just just kill me now. My boobs are up to my neck and I would like to die.
Yeah. No, I knew too, just like being in that kind of pain before. Well, then even after I knew what was going on before the surgery, you look forward to the surgery because you're gonna get some type of relief. Even the recoveries, it's gonna suck, but there's like a light at the end of the tunnel. But there were days where like I was irritable, like you were just so irritable and you have no patience for anything. Because I'm just like I just want a heating pad and I just want to lay down and like don't fucking talk to me because like it
No.
hurts to do any. There is no comfortable spot unless I'm laying down, like because I need my head to be supported at this point.
Yeah.
So it is frustrating. And so I would just say, educate yourself on when you're just gung ho on certain regulations that a headline on, curbing the opioid epidemic, curbing addiction, how, like what does that actually mean? Like
Yeah.
actually educate yourself on everyone that's affecting. I mean, is it going to give those who need help with addiction, are they actually going to have the access and get the help that they need? And then those who actually need pain management, is that going to affect them as well? I mean, don't just automatically just jump on board and think that those who need it aren't going to be affected.
Yeah.
And then just because they don't look sick doesn't mean that they're
Yeah.
not.
And I think another thing we want to like emphasize is fight for yourself, because I think that was a huge thing for Monica, was that like
Yeah.
she wouldn't accept as an answer. You know what I mean?
Yeah.
Like she was constantly going out and researching everything that she possibly could, and she was trying to, and part of that was because she had the privilege in which to do so.
Right. Yeah.
She had the access, like she had a job that had um good insurance, or
Yep.
an insurance
Yeah.
that was good enough that would allow her to like kind of shop around and find specialists that could help her.
She has a good
But
support system
yeah,
that could
good
take
support
her
system.
to appointments. I mean, that's
Yeah.
another thing too, is like you might have the okay insurance, you might have a doctor, but if you're in that much pain or if you need a surgery and you don't have someone to take you, you can't, what are you gonna do? You can't get it.
Yeah. So, I mean, unfortunately, even there are people like who are listening to this. You do have to be privileged in order to listen to this too,
Yeah.
which is kind of unfortunate that like there's no way for people that we wish everyone could hear like some like get some help in some way. And it's it's a fucking shitty side, but if you are fortunate enough to listen to this and listen to us, whatever. Sorry, but if you are fortunate enough to be able to like hear this kind of information, and it could be new to you, but like keep trying to fight for yourself. There are other people out there that are willing to fight for you as well.
Yeah.
It might seem like you're fighting an uphill battle, but keep going. There are like-minded individuals out there. There are people that are very, very compassionate, and they could be few and far between, but they are there, and they will fight for you. Like Jess and I were talking the other day about how sometimes in the medical community you can find a lot of people that are just so completely apathetic, and they won't give you that individualized care that you so desperately need,
Yeah.
especially when you're experiencing a very traumatic and emotional experience, and all it takes is to have one compassionate person to turn everything around and to make it so that it gives you hope, because when you're in this very emotional traumatic time, every
You need something to hang on to.
yeah. So keep try to keep that compassion for yourself and fight for yourself, and you will that'll be kind of like a beacon that will shine to other compassionate and empathetic people. And I this could be like the magic and fairy tale rainbow part of me that's thinking like it'll like I think that you'll find some help.
Yeah, no, I think you will, and I think like I said, there's so many other ways that you could get support if you are lacking with certain access to care.
Mhm.
Looking at again support groups with online communities could be a huge support if you don't have that immediate family friends right there to help you.
Yeah.
And not only that, but they could help you guide you and what, have you asked your doctor this specific question? Or,
Yeah.
listen, like I lived in your area, I live in your surrounding area, like contact XYZ doctor, they might be able to help. Somebody who's been through the ringer and has that kind of experience is usually a wealth of information on kind of how to find the loopholes with the insurance companies and what verbiage you need to use to get whatever procedure approved. I mean, those are huge helps.
Yeah.
Um, just knowing that, like you said, you're not alone, even though you feel like it, especially if
Oh yeah.
especially if you do have a rare disease. Just the frustration of thinking that you're crazy.
Mhm.
Every time you see a doctor and they're telling you like you're fine, you think
Yeah.
you're nuts, but you know wholeheartedly that no, there's something going on.
Yeah.
Sometimes it does help to reach out to those who have certain diagnoses to get at least a guidance on like what to ask. That you, because at some point you don't even know where to start.
Yeah.
Oh,
So keep fighting. Always keep fighting.
yes,
And like if no one else will fight for yourself.
yes,
So with that being said, we will wrap this episode up. I think this is there was a wealth of information,
I think
and
so.
I feel like if you guys have any questions, let us know. But you can find us on all the social medias. We have Facebook, we have Twitter, we have Instagram, and we have YouTube. So you can like all the things. You can subscribe on YouTube. Um, please give us feedback if you have any, and if you have any questions or comments, concerns, injuries, suggestions, let us know.
Yeah.
All right. And until next time, we love you. Bye bye.
Bye.